Namaste. I'm Dr. Amita Phadnis, Pediatrician and Neonatologist and Director of Oyster and Pearl Group of Hospitals, Pune. So continuing on our Aarogya Katta. Last time Dr. Neeraj Rayate, who's with us again, he's sharing his valuable time, spoke to us a bit about laparoscopic surgery and how that is the way for the future and what are the solutions for obesity. Now we are going to talk to him about a very common problem, which is hernia. So Dr. Rayate, how do you diagnose hernia?
This is a very valid question, madam, because a lot of people have no clarity about what is hernia and how do we know them. So any bulge which comes in a very common areas where hernia is known can be scientifically called as hernia. This is usually seen on the abdominal wall. So when this bulge is in the upper part of the abdomen, it's called as an epigastric hernia. When it is around the umbilicus or in the umbilicus, it's called as paraumbilical.
Or the navel, you mean, right?
Yeah. Umbilical hernia. When it is in the groin region, very common in males, it's called as inguinal hernia. So first and foremost is the symptom or a complaint of a patient that he has a swelling or a bulge in these particular parts. The easiest way to know whether I have a hernia or not is to get one sonography, an ultrasound of the abdomen or the affected part done. Now when we evaluate it sonographically, we get multiple information. What we importantly get is the defect size of the hernia, what are the contents of the hernia, because hernia is usually in continuation with the abdominal cavity. So we need to know what is there which is going inside the hernia, and based on that then the treatment can be planned for the hernia.
So what are the surgical solutions for treating hernia? And is there any medical solution for hernia, or it is an out and out surgical problem?
Frankly speaking, we treat hernia surgically only when they are symptomatic. So these days, because of the advent of sonography, very tiny hernias are also picked up on the investigation. So defect size of 0.5 centimeter, 0.5 centimeter or 1 centimeter, patients do come to us and we tell them to wait and watch and build the abdominal strength. Hernia which is symptomatic, where there are problems to the patient, lot of patients don't know. They feel that it needs to be treated only by the conventional cutting or surgical method. Almost all hernias these days can be very well treated by laparoscopy. The advantage being minimal pain, shorter hospital stay, and patients go home in 2 days time. So that's effectively 24 hours hospital stay. The biggest advantage is even if we are doing these hernias by minimal access, we use good amount of sizes of meshes which can be placed inside by rolling into the abdomen. Now, since these meshes come from inside the patient's abdomen, anything which causes increased intra-abdominal pressure will further oppose these meshes to the hernial defects and will cause better restructuring of the defects.
Okay. And what would be, like, I have seen that a lot of patients want to postpone the hernia surgery. So would you be able to tell our viewers what are the risks involved if a hernia surgery is postponed despite the surgeon recommending it?
So very valid question. Invariably when patients come to us, they have some or other symptoms of hernia because of which they turn up to the doctor. So most important thing which we see is whether these hernias, especially because you must be seeing a lot of babies also.
Yes.
So what we see is whether these hernias are reducible or not reducible. So if the size of the swelling which is coming is not decreasing, if the contents of the swelling if they are not going down, then it's an alarming situation.
So why do you see the bulge actually in the hernia? What is the bulge?
So the bulge is basically the contents inside the abdomen which are coming into the bulge. And that is why it is of concern, and that is why it needs to be treated on priority. Many times parents of babies don't want to undergo surgery, but that's an absolutely wrong choice because kids are more vulnerable to have complications. So any hernia where the size remains constant, increases, or is an irreducible hernia needs to be attended and treated on priority.
So viewers, don't ignore any bulge on your abdominal wall. If you find there is a bulge, reach out to the surgeon. At ONP hospitals, we can give you all the solutions for hernias. Thank you.
Thank you.